1 in 8 men will get prostate cancer in their lifetime, and it's actually the most common cancer after skin cancer, which is why early detection is key. So here now is Dr. Munoj Bupathi, and he's an oncologist with the Sarah Cannon Cancer Institute at Health One. And doctor, who should get screened for prostate cancer?
Hello, thank you for having me for this segment. So all men should get screened for prostate cancer. It's been quite controversial over the last few years. Specifically, those who have symptoms should definitely be screened. Some of the symptoms include difficulty with urination, dribbling of urination or excessive urination at night, probably the most common symptoms that we tend to see.
Perfect. And are there any risk factors of the disease that men should know about?
So genetic risk factors do exist for prostate cancer. It's been more known now that there is a genetic link, especially for patients who have family history of breast cancers or other breast cancers, other prostate cancers, ovarian cancers in the family, should all be considered strongly or should strongly be considered to have testing done for prostate cancer, either it be the genetics or even for screening purposes.
What kind of treatments exist for prostate cancer?
Yeah, so there's this is a kind of in a very exciting area in cancer therapy, or one of the very exciting areas. There's been a lot of advances for treatment of prostate cancer in general. A lot of new oral novel therapies that have been coming up to development. There's also been a lot of therapies and targeted agents that are being looked at in prostate cancer, immunotherapies, CAR T cells, radiopharmaceuticals, or drugs like lutetium have also been looked at in prostate cancer, have been showing very promising results. So those that have advanced or metastatic prostate cancers, there are a lot of very hopeful options that have been on the horizon.
Which is great news. And we know oftentimes men are notorious for putting their health on the back burner a little bit. What's your message to someone who's been putting off that checkup, and anything else you want viewers to know?
Well, since this is now National Prostate Cancer Month, let's take this time to go ahead and get checked. Don't put off any symptoms any longer, and that would be my sincere advice to anyone out there.
Is there anything we haven't touched on that you think is important for people to know?
No, I just think that, cancer nowadays is very different than what it has been in the past. Don't lose hope. Try not to be scared, and have a friend with you and go get checked.
Great. Thank you so much, Dr. Bupathi. We really appreciate your time and information.
Absolutely. Thank you.
Great. And for more prostate cancer resources, you can head over to cbsdenver.com.